We've been given some funding from Better Start Bradford to work in 3 different wards within the Bradford area where we know that there's a lot of health inequalities. We know that the people struggle financially in terms of budgeting to be able to provide a healthy start for their young children. We also have issues around oral health in terms of tooth decay and children with missing or filled teeth, and parents knowing how to make sure that they have a healthy start in terms of the teeth. We know that there's a lot of other issues around housing and debt and unemployment. We look at activity ideas, we look at portions and portion sizes so that we know how much to give our children so they're not getting too much, or make sure they're getting enough. We look at top tips around dealing with fussy eating. We know that there are some more inequalities in the north in terms of people's finance and social demographics. We need more funding to be able to support all those different communities.
HAPPY stands for Healthy Active Parenting Programme for the early years, and the women that come to our programme have a body mass index greater than 25. We normally recruit women from about 22 weeks of pregnancy up until about 36 weeks, and they come on for 12 weeks. It's really important in Bradford because some research in the Better Start Bradford area shows that 46% of the children who enter school are overweight by the age of 5 or 6. So we really need to look at preventing that. More funding would help because we could roll this out across Bradford, and we could reach communities that really need the programme.
We lived in a different part of Bradford before, Allerton, and I felt like we didn't really get much support. So I do think funding's a big thing. Like it's a really big thing that Bradford does need a bit more of, because all these things that we have got now, I really appreciate it from just living in a Better Start area.